Shoulder dislocations can happen to anyone that has the right type of injury. Most commonly in my practice, I'll see collision athletes, people that are involved in hockey or football or rugby. We see rodeo players and motocrossers. Workers' comp injuries can lead to shoulder dislocations. Shoulder dislocations are more common than other dislocations, including the knee and the hip or the ankle or the elbow. And the reason for this is because the shoulder has so much motion. It's more of a golf ball sitting on a tee than it is a true ball and socket. And so it relies on the soft tissues to hold it in place. And with that mechanism we described, it tears the labrum and then the shoulder isn't stable anymore. It leads to a dislocation. Shoulder dislocations are treated differently depending on who gets the injury, how it happened, what age. In a younger patient, they're more likely to have recurrent dislocations. A younger patient, a younger athlete, will more frequently have recurrent dislocations, which would lead to the need for surgery. For recurrent shoulder dislocation, the most common treatment is an arthroscopic reconstruction, a stabilization of the labrum, sewing it back down to the glenoid. And this is usually effective, and the patients can typically get back to their sports. When a patient comes to the office for a new shoulder problem, whether it's dislocation or any other problem, we start with a history, a physical examination. We review the x-rays. Sometimes an MRI is necessary. We find out, how did the injury occur? What kind of treatment have they had so far? What are their goals and expectations? Have the injuries been happening frequently? We examine them. We find out what position may their shoulder have been in when it came out of socket, or what sorts of things can't they do. If we put them back in that position in the office, it gives us some information. We look at the x-rays and we look for pathologic lesions on the x-rays. Many times with these injuries, since they're soft tissue injuries, we will need to get an MRI and study that. Then we use all that data and we come up with a treatment plan. Is this somebody that is likely to do well with a rehab program, or is this somebody that is going to probably need to have surgery? We can then discuss the surgical types of treatment, pros and cons, how we do that. After a shoulder dislocation or after the surgery, for the first 6 weeks or so, the patient has to keep his arm down. He would avoid that same kind of mechanism that got him into trouble in the first place. Then after about 6 weeks, we get started with range of motion, and then following that, strengthening exercises. After that, we start doing the more sport-specific exercises and get them back into their game.